Hi, this is Cynthia with Subconscious at Work. See if it's going to quit spinning for me here. Okay, here we go. This is just a little bit of information for you. Everybody is out there and scared as they've heard so many things about this COVID-19 scare. So I thought I would come on and talk to you a little bit about it. As we know, this virus began in late 2019 all over the world. It is, and it's been transmitted, transitioned, however you want to state it, several times from its origin in a food market in Wuhan, China in December of 2019 to countries across the world. And this has just been off the board with as many viruses as that's going on. The disease was caused by an infection with SARS-CoV-2, so it is now called COVID-19, and it stands for the coronavirus of 2019. In spite of the global pandemic in the news about this virus, you're unlikely to contract the SARS-CoV-2 infection. The coronavirus is spread, as we're being told, and it's similar and different from other coronaviruses. How to prevent spreading it to others if you're suspected of contracting this virus. Doctors are learning many new things every single day about this virus. And so far, we know that COVID-19 may initially cause any symptoms for some people. They are far and wide. Some people are asymptomatic, where they are not having any symptoms at all. Some people are carrying it. They infect 10 people. They infect 10 people. They infect 10 more people. So that's how this is being spread so quickly. Others may not even realize they're sick. So they may carry the virus 2 days to up to 2 weeks before they become symptomatic. Some of the symptoms are shortness of breath, having a cough that gets more serious over time, and running a low-grade temperature. And they're now even saying this morning that pink eye. So every day, the CDC is receiving different guidelines and different imbalances with people, and so they keep updating their information. These symptoms may become more severe in some people. Call the emergency medical service if someone you care about is having any of these symptoms: trouble breathing, blue lips, persistent pain or pressure in your chest, excessive drowsiness, confusion. And the more severe cases, of course, are going to have acute respiratory distress. They're going to have an irregular heartbeat, cardiovascular shock, fatigue, heart damage, heart attack. How we prevent this, and the symptoms are more, how we prevent this is by washing our hands frequently, and as they're stating, as you've heard many times, repeat the ABCs or happy birthday 2 times. Wash them in warm water with soap. Don't touch your face, as I already said, your eyes, your nose, your mouth, if your hands are dirty. Don't go out if you're feeling sick or have a cold or have flu symptoms. Stay at least 6 feet away from anyone who is coughing or sneezing. Cover your mouth with the inside of your elbow whenever you sneeze, and if you're using tissues, throw your tissues away right away, and make sure you wash your hands. Clean any objects you touch. Use disinfectants on phones, computers, utensils, dishware, doorknobs, anywhere. Your bathroom. Being that we are healers, and we can heal. We can use olive leaf extract and oregano oil, thieves, tea tree, coconut oil, silver shield, colloidal silver. There are different things that we can utilize. And we can also go into your immune system and your lymphatic systems and boost up your immune system to make sure that it can combat this. That doesn't mean it's going to. It may. The fear that is feeding this is not helping in any way. There's so many news outlets with different stories, and we see several stories a day. I know that ours is interrupted 3 to 4 times a day, and it's different advice every single time. So it's hard not to be afraid. But please just follow the guidelines and do as you're asked. Stay home if necessary. This is a very hard time the world is going through right now. And if we come together as people with love, with compassion, help those people that are not able to get out. But don't allow yourself to form the fear of this. Remember that it's really blown out by news outlets. Remember to take proper prevention, though, because you're also at high risk if you're living with someone who has the disease, contacted the virus, or you are providing health care for someone who has contracted the virus, or you have an intimate partner that has the virus. So make sure you take precautions. And older people are at risk. Babies are at risk because their lungs are not developed, their immune systems are not 100%. So for certain immune dysfunctions, we are at risk. Cancer patients can be at risk. Severe obese persons can be. Certain heart conditions, lung conditions like COPD, and other conditions, if they're not well controlled, such as diabetes, kidney disease, or liver disease. Pregnant women that are having high-risk pregnancies are also in that line. They diagnose this similarly to other conditions caused by viral infections using blood, saliva, and our tissue samples. They are using a cotton swab to retrieve samples from the inside of our nostrils, and the diagnoses don't come back as quick as we would like them to. Treatments are available for the bacterial part of the infection, but if it's viral, it cannot be treated. They are using some quinine drugs and a couple others, but I haven't heard a lot of positivity about those in the last couple days. There's currently really no approved specifically drug for this virus. The treatments they are offering are managing the virus itself until it runs its course. The officials state that this has mutated 3 times and that they are aware that this could mutate again. In some cases, experimental treatments have been present using antiviral or retroviral medications, breathing support, such as ventilators, which are so important. That's why they're asking for so many. Steroids for the people with the lung issues are being used. Blood plasma transfers. There are some severe cases out there, and these people need to seek help. They need to contact their doctors. The doctors are actually doing phone calls now. They're doing FaceTime with you so you can speak to them, so you can see them, they can see you. You just need to reach out. Clean any objects you use a lot, and stay up to knowledge on what's going on around you. Stay aware of all information. Wash your hands frequently, and I cannot stress that enough. If they make sure you dry them well because they can get cracked, and if so, apply lotion. Maintain the social distancing that they're asking for. Maintain the quarantine that they're asking for. We don't want more people to get this. Avoid touching, and I've said it probably a few times already, your nose, your eyes, your mouth. And you see me do it a couple times, but I just washed my hands before I came up. Practice respiratory hygiene. Take those deep, full breaths. Breathe into 6, hold to 4, and breathe out. Make sure you're taking big breaths. They're even suggesting drinking hot teas, hot water, making hot soups, because the hot will open up the airways, the cold will constrict. If you have a fever, a cough, difficulty breathing, please seek medical care. Stay informed, follow the guidelines, and please be careful. Think of other people. This is a time where we should all be coming together as one, being there for one another, showing the peace, the love of neighbors, the love of everybody. Please stop and think that you don't want anybody else to get this. Bless you and have a great day. And if you have any questions, don't hesitate to contact us at Subconscious at Work. Thank you.